So we have an awesome panel up here today who are going to talk to you about what it is we need to do and what it is we're doing in order to make those saving lives a reality. So the first person that I'm going to introduce, doesn't need any introduction, but we can give him one anyway. Mark Dudzic is the national coordinator of the labor campaign for single payer, our mentor and leader in so many ways. Koki Giles is the president of the California Nurses Association and vice president of National Nurses United. Sophia Sepulveda, you go girl. I am so bad with names, I can't even pronounce my own sometimes. I'm just giving you a heads up. So Sophia is the healthcare organizer for the Texas Organizing Project, all the way from Texas. I came from New York, so I am not envious of anybody that just came from Texas, I'm just saying. Ben Day is the executive director of Healthcare Now. Koki wanted to go first, did you and Mark decide? Mark is going to go first.
I wanted the coin toss here. Okay, well, good morning again, brothers and sisters. It's wonderful to see everybody here at our National Strategy Conference. We put a lot of thought and a lot of work into this and really want to recognize the work that you all have done to move this. So we met 3 years ago in New York City in January 2017. And it was a pretty bleak moment. Trump was just about ready to be inaugurated. He was vowing to dismantle the Affordable Care Act, replace it with nothing, and dismantle a whole slew of other public programs that working people depend on for survival. And we had just come off a disastrous national election when our Democratic candidate vowed that we will never, ever have Medicare for all in this country, that it was a waste. So today we're in a very different moment. Trump is still president, and we face catastrophic disaster if that continues much longer. But we are in a situation now where majorities of the American people consistently support Medicare for all, even when they're hammered with negative questions and messaging. Medicare for all is the litmus issue in every single presidential debate and on almost every single political campaign in this country. We have seized the terms of debate on the future of health care in this country. H.R. 1384, the Medicare for All Act, is in Congress. It's a great bill, 118 sponsors, I'm sorry to say. We lost Elijah Cummings 2 days ago. Elijah was a champion of healthcare justice. I know that there are people in his district who are making sure today that he will be succeeded by someone who will continue to carry the torch for Medicare for all in that key congressional seat. And this is straight up in my world, for the first time since the mid-1990s, when my poor, benighted labor movement lost its way again, unions that represent a majority of organized workers in this country have endorsed actually existing Medicare for all legislation. So this is a gigantic paradigm shift in how people have thought about the future of healthcare in this country. It's a huge shift in public opinion and public thinking. And it's really a moment that comes rarely. I think we're kind of on the cusp of one of those magic moments that the Irish poet Seamus Heaney described when he talked about how once in a lifetime, hope and history rhyme. And this is one of those moments when hope and history just might rhyme. So we should really be proud of what brought us here, what we have accomplished, and I want to thank everybody in the room for the work that you've done, and I want to thank the organizations that sent you here, because that's the core and the spine of our movement. But I also have to tell you that I'm an old union organizer. And are you clapping because I'm old or I'm an organizer? And I gotta say that this feels very much like that moment in a union organizing campaign right before the boss finds out that the union is in the shop. This is very much like that moment. where everybody's together, we're all excited about the future, but we have not yet experienced the reign of terror that's going to be unleashed against us. That the divisiveness, the divide and conquer, the lies, the threats, the air war, the sea war, the land war that will be taking one at a time, trying to chip away the unity that we've built. So this is the moment for organizers. This is the moment for us to step up. And there's a couple of tools that are very important from the Labor Organizers Toolkit. Number one is inoculation. Now is the time to prepare our people for the lies and the attacks that are coming, so that when they come, they see them for what they are and they can stand up to them. Now is the time to inoculate. Another pretty cool tool that we try to use is what organizer Jane McAlevey calls a structure test. Think about the kind of structures we need to win and test them. Ask them to do what we expect them to do and evaluate what worked and what didn't work and adjust your tactics and strategies accordingly. So a couple of national labor leaders actually kind of failed their structure test last month when they had a chance to defend their union's commitments to Medicare for All. And instead, they kind of backpedaled away and started talking about some utopian idea that employer-based insurance might need to be preserved, as if that was a good thing. So what did we learn from that structure test? What we learned in the labor campaign is that the support for Medicare for All is strongest in the actual trenches of the labor movement. The people who negotiate the contracts, the people who have to face the members every day and listen to their stories that they have not only as workers, but in their communities and their family members, that there is a whole working class that goes beyond just workers in your particular union, and our members are part of that class and live in that world. So those are the people who are going to move this forward. So what we decided we would do is organize those folks to remind the national leadership of the strength of the support for Medicare for All in our movement. And we did this 10 years ago before the 2009 AFL-CIO convention to sort of set the stage for passing a resolution supporting Medicare for All. At that point, we got about 1,000 people to send letters into the AFL-CIO. This time, in less than a week, we got 2,500 letters passed. So we passed that structure test. That section of the labor movement passed that structure test. So, brothers and sisters, as we move through this weekend, I just ask you to think about power. Because when they tell us that Medicare for All is not politically viable, which is the only argument that they have about Medicare for All, what they're really telling you is we do not have enough power to win it. So the challenge for us is to build power to win this fight. So ask ourselves, where does our power come from? How can it be amplified? How can we bring new forces to the fight? How can we marshal the resources to win? Ask ourselves, who are our enemies? How is their power sustained? How can they be weakened and isolated? And finally, let's ask, who are we talking to? Are we talking to the same crew of true believers in the church basement or the union hall? Or are we making an effort to bring new voices and new forces into our movement? So we've got a lot of work ahead of us, brothers and sisters. And there's one more thing that I learned as an organizer, and that's that history doesn't move itself. To paraphrase Frederick Douglass, moments come and moments pass, but moments don't last forever. So we need to seize the time. Thank you.